Hi, my name is Josh Schneebel and I'm a third year exercise science student at Charles Sturt University. Today I'll be discussing the role of exercise in preventing and managing chronic disease. So the objective of this presentation is to discuss what chronic disease is and what the prevalence of it is today. We'll also discuss the causes of these diseases and how they manifest. Lastly, we will examine the role of exercise and what it can do to help prevent these diseases and manage them. We'll take a specific look at a couple of diseases in particular, and then brush over a few others. Chronic disease, so what is it? It's a long-term illness. Long-term means anything over 3 months. It's generally lifestyle related, usually incurable but manageable. It's estimated that in 2005 alone, 35 million people died globally from chronic diseases and related conditions. So you can see that it's not just high in Australia, but globally chronic disease has a high prevalence. So this table is just published by the Australian Bureau of Statistics in 2012, so it's fairly recent. We can see that ischemic heart disease and cerebral vascular diseases for the last 10 years have been number 1 and number 2. So that's just heart disease, so coronary heart disease is the first one, and cerebral diseases, that's stroke. So that's number 2. Interestingly, jumping from number 6 to number 3 in the last 10 years is dementia and Alzheimer's, and jumping from number 9 to number 6 is diabetes. So interesting that those two diseases are on the rise in the last 10 years. So lack of exercise can be a contributing factor to a variety of these diseases. The diseases that it can affect include metabolic conditions, so diabetes, cardiovascular disease, so anything to do with the heart, so heart disease, stroke, things like that, like atherosclerosis as well. Pulmonary diseases, so asthma, COPD, which is chronic obstructive pulmonary disorder. Cancers, particularly breast cancer and colon cancer. Neurological disorders such as Parkinson's disease, Alzheimer's, and Hodgkin's disease. Musculoskeletal disorders, so muscle imbalances, tightness, even lower back pain. Gastrointestinal conditions, so things like constipation, even though it's minor. Immune system alterations, sarcopenia, so muscle wasting. This can be evident in diseases such as HIV, cancer, and can even be evident in aging. All these conditions reduce the quality of life and shorten the life expectancy. Alright, so what's the cause of these diseases? One theory is that inflammation can be a contributing factor to a host of chronic diseases. It's theorized that inflammation of cells can lead to varying chronic diseases. For example, the adipocytes, once there's inflammation in those cells, it can lead to insulin resistance, which further leads to type 2 diabetes, or inflammation in neural cells, which can lead to neurological disorders. It's also theorized that exercise can decrease these inflammatory markers in skeletal muscle, which is explained by the production of PGC1 alpha as a anti-inflammatory mediator, and this is stimulated through exercise. So we can see from this that exercise can help with inflammation. We'll go into this more in depth later on in the presentation though. So now let's take a brief look at how exercise can improve quality of life for people suffering from a range of disorders. Firstly, heart disease. So exercise has been shown to have a positive effect on chronic heart failure. It's thought that exercise produces an antioxidative effect, stimulating scavenger-like enzymes to negate the negative effects of free radicals. Another example would be in HIV and AIDS. Resistance training has been shown to slow down and sometimes negate the effect of muscle wasting, which comes with having AIDS. Muscle wasting is also prevalent in populations such as cancer patients and the aging. So resistance training has been shown to halt muscle wasting. So that's a positive effect for those populations through exercise. Chronic fatigue is another one. No one really knows what causes it, but its symptoms include just being fatigued in general, headache, excessive tiredness, and headaches. Gentle to moderate exercise has been shown to improve energy levels and reduce symptoms. Similarly, in cancer patients, they've reported rates of lower fatigue, exercise may also reduce the chance of tumours returning through increased immune function. So next, like we mentioned before, neurological diseases are on the rise. One explanation for how these diseases take hold is through neuroinflammation, so inflammation of the neural cells or the neurons, which causes an activation of glial cells, which release cytokines, namely tumor necrosis factor alpha or TNF alpha. The release of this TNF alpha leads to the death of dopamine-containing neurons, which in turn will lead to neurological disorders such as Parkinson's disease. So how can exercise help these neurological disorders? It's thought that exercise can help reduce the rate of inflammation, or at least control it, through hormones such as adrenaline, cortisol, growth hormone, prolactin, and other compounds, which serve as a moderating effect on inflammation. So the next disease we'll look at is type 2 diabetes, which is a metabolic disease. Symptoms include hypoglycemia, which is elevated blood glucose levels, abnormal glucose and fat protein metabolism. So this basically means the cells can't uptake the nutrients efficiently, causing a higher amount of these macronutrients to be floating around in the bloodstream, which can cause all kinds of damage. So excess glucose floating in the bloodstream can cause corrosive damage to the artery walls, which in turn allow cholesterol fats to get caught in there, which leads back to what we were saying before with atherosclerosis, so that accumulation of plaque, which can also lead to heart attacks. So we can see how these diseases are all linked. How can exercise help this? So we know with diabetes, the problem is with the insulin receptors. So they either are not sensitive anymore to insulin, so the nutrients can't get into the cell, or the receptor sites are overworked. One way exercise can help this is exercise induces the production of more GLUT4, and as we can see on the diagram on the right hand side here, if our insulin receptors aren't working, we can use the GLUT4 glucose transporter to shuttle nutrients into the cell. So it's kind of, we can take a back way from using insulin, and we can use GLUT4 instead. So that's one adaptation from exercise. Exercise has also been shown to increase insulin sensitivity, so we can also get some of that sensitivity back. So another way that type 2 diabetics can be helped with exercise is, I've got a little flow chart here. Exercise can lead to the production of PGC1 alpha, which we touched on before. But how does this happen? So we exercise, we break down ATP, we break it again down to ADP, and then when we exercise long enough or intensely enough, break it down to AMP. So that stands for adenosine monophosphate. When we have an accumulation of that, we have AMP kinase, which is just an enzyme to break down adenosine monophosphate. When we have a build-up of this, it signals PGC1 alpha to present, and studies have shown that when PGC1 alpha is present, there's gene expression of mitochondrial genesis, which pretty much just means there's more mitochondria being made by the body. So what does all that mean? It means through exercise, we can produce more mitochondria, which means we can oxidize more fat, we can metabolize more nutrients, we can have a higher metabolic rate, all things that are beneficial for someone with type 2 diabetes. Last of all, I just wanted to have touch on taking prescription medication. So exercise can sometimes have the same effects as prescription medication. So in this study, it can show that exercise can lower heart rate, which could be a positive alternative to taking ACE inhibitors. ACE inhibitors are a pharmaceutical medication to treat hypertension, so high blood pressure, but some side effects can be hypotension, renal impairment, can cause a cough, and in some rare cases can cause anaphylactic reactions. All things that aren't ideal, and so exercise could be a possible alternative measure to using prescription medicine like ACE inhibitors. So in conclusion, we can see that chronic disease is quite prevalent in Australia. We can also see that it can be managed and even prevented through exercise, namely through those pathways that we discussed before, so compounds such as PGC1 alpha and GLUT4. We can also see that exercise can have health benefits similar to prescription drugs. Obviously, some prescription drugs are needed in more serious diseases, such as cancer or HIV, but exercise can elicit still some health benefits. I hope this presentation has helped convince you that exercise can be used as medicine. Thank you for watching.